Salmeterol drug information section by section so you have exam-ready notes with both clinical and nursing aspects. Salmeterol Complete Drug Monograph. Generic name, drug class, brand name. Generic name Salmeterol. Drug class, long-acting beta-2 adrenergic agonist, LAB. Brand names, Ceravent Discus, Salmeterol alone, Advair Discus, Advair HFA, Salmeterol fluticasone, Air Duo, Salmeterol fluticasone, Wixela Inhub, Salmeterol plus fluticasone, generic version. Definition. Salmeterol is a long-acting bronchodilator inhaled medication that selectively activates beta-2 adrenergic receptors in bronchial smooth muscle, provides 12-hour bronchodilation, unlike short-acting beta agonists like albuterol, which lasts 4 to 6 hours. Used for maintenance therapy in asthma and COPD, but not for acute attacks. Number 3. Mechanism of action. Salmeterol binds to beta-2 adrenergic receptors in airway smooth muscle, stimulates adenylate cyclase, increases CAM, cyclic adenosine monophosphate. Elevated CA activates protein kinase A, pKa, reduces intracellular calcium, smooth muscle relaxation. Lipophilic side chain anchors drug to the receptor, giving long duration, 12 hours. Results: bronchodilation, inhibition of histamine, leukotrienes, and cytokines release, anti-inflammatory adjunct effect. Number 4. Uses. Maintenance therapy of asthma, only with inhaled corticosteroid. Prevention of exercise-induced bronchospasm. Long-term maintenance treatment of COPD, chronic bronchitis, and emphysema. Number 5. Indications. Asthma, G4 years old. In combination with inhaled corticosteroids, ICS, when asthma is not controlled by ICS alone. COPD, for airflow obstruction and prevention of exacerbations. Exercise-induced bronchospasm, prevention when used 30 minutes before activity. Contraindications. Hypersensitivity to salmeterol or milk proteins. Dry powder inhaler contains lactose. Monotherapy in asthma, boxed warning, increased risk of asthma-related death. Primary treatment of acute bronchospasm or status asthmaticus, not fast-acting. Number 7. Before taking this medicine, precautions. Important nursing medical precautions. Cardiac conditions may cause tachycardia, hypertension, arrhythmias. Seizure disorders can lower seizure threshold. Thyrotoxicosis increases sensitivity to adrenergic stimulation. Diabetes may increase blood glucose. Hypokalemia risk, especially with diuretics, corticosteroids, or theophylline, not a rescue inhaler. Patients must always have a short-acting inhaler, albuterol. Must always combine with inhaled corticosteroids for asthma. Number 8. How to use administration guidelines, delivered as dry powder inhalation, discus device. Step by step. 1. Open discus device. 2. Slide lever until a dose is loaded. 3. Breathe out fully, away from device. Place mouthpiece to lips and inhale deeply and quickly. 5. Hold breath for 10 seconds. 6. Exhale slowly. 7. Close device. Do not exhale into inhaler. Moisture can damage powder. Do not use more often than prescribed. Number 9. Dosing information. Asthma, 4 years old. 50 milligrams, 1 inhalation twice daily, morning and evening, 12 hours apart. COPD adults, 50 milligrams inhaled twice daily. Exercise-induced bronchospasm, 50 milligrams at least 30 minutes before exercise. Do not repeat within 12 hours. Maximum dose, 100 milligrams per day, 2 inhalations. Number 10. Missed dose and overdose. Missed dose, take the next scheduled dose, do not double. Overdose symptoms, tachycardia, arrhythmias, hypertension or hypotension, tremors, seizures, hypokalemia, hyperglycemia, emergency medical attention required. 11. Stop or avoid taking. Stop immediately and contact healthcare provider if paradoxical bronchospasm, worsening wheezing or dyspnea right after inhalation, allergic reaction, rash, swelling, difficulty breathing, severe chest pain, palpitations, or fainting. Do not abruptly discontinue in asthma. Taper under medical advice. Number 12. Side effects. Common: headache, nervousness, tremor, throat irritation, hoarseness, cough, muscle cramps, joint pain. Serious, rare, paradoxical bronchospasm, tachycardia, palpitations, arrhythmias, hypokalemia, muscle weakness, irregular heartbeat, hyperglycemia, especially in diabetics, increased risk of asthma-related death if used without ICS. Number 13. Vital information. Key nursing, patient education points. Never use as rescue inhaler, not effective for acute attacks. Always carry LABA, albuterol, for sudden symptoms. Must be used with inhaled corticosteroids in asthma to reduce mortality risk. Regularly monitor pulmonary function, FEV1, peak flow, blood pressure and heart rate, blood glucose and potassium levels in at-risk patients. Educate patient to report worsening symptoms or need for more frequent rescue inhaler. Number 14, drug interactions, other drugs that affect salmeterol. Beta blockers, propranolol, atenolol, antagonize effects, reduce efficacy. Strong CYP3A4 inhibitors, ketoconazole, itraconazole, ritonavir, plasma concentration, toxicity risk. Other adrenergic agents, ephedrine, pseudoephedrine, additive cardiovascular effects. Diuretics, loop and thiazides, risk of hypokalemia, arrhythmias. MAO inhibitors, tricyclic antidepressants, cardiovascular side effects, tachycardia, hypertension. Theophylline, additive hypokalemia and arrhythmia risk. Summary, salmeterol is a LABA bronchodilator used in asthma with ICS, COPD, and EIB prevention. It provides 12-hour bronchodilation, but not for acute attacks. Serious risk exists if used alone in asthma. Careful patient education, monitoring, and avoiding dangerous drug interactions are crucial. Thank you. Have a nice day.